Well, up first, let's bring you India's latest numbers as far as coronavirus goes. And India has recorded 54,87,580 COVID cases so far, with 86,961 new infections and 1,130 deaths in the last 24 hours, which have pushed the total death count to 87,882. 93,356 patients have recovered from the infection in the country in the last 24 hours. And this is for the third straight day that the number of daily recoveries is higher than the daily cases. With 43,96,399 people in the country having recovered since the beginning of the pandemic, the overall recovery rate now stands at 80.11%. Well, this brings you now to our first big focus on the show today, and a new study in Karnataka which has found that the spread of coronavirus infection in the state is significantly higher in the symptomatic cases, though asymptomatic persons too can transmit the virus. This was one of the major findings of the study conducted in Karnataka by health experts from the Indian Institute of Public Health Foundation of India, and State Surveillance Unit, Directorate of Health and Family Welfare, among others. The main focus of the study is specifically on how the symptomatic persons have driven the transmission of the disease in the state. Well, to talk more about this, we're joined by one of the authors of that study, Dr. Girdhar Babu, Professor and Head Life Course Epidemiology, PHFI in Bengaluru, someone who's working closely with the Karnataka government. Thank you so much for joining us on the show today. First and foremost, tell us about the main findings of this study.
Thank you for having me on this show, Gagi. This study is led by Professor Ravi, who is a renowned virologist in India. And this was actually to examine what is the dynamics of transmission when you consider both symptomatic and asymptomatic. So what we found was symptomatic people tend to give more clusters from within them. So if you look at the total number of symptomatic and asymptomatic that we considered, asymptomatic were actually nearly 10 times higher than symptomatic. But in terms of the clusters that were as a result of secondary attack rate, what we call, that was higher for symptomatic compared to asymptomatic. Not just that, the proportion of comorbidities in the symptomatic was higher, which means that probably people with comorbidities are the ones who will develop symptoms. And also the death rate or any other complications was higher in symptomatic. Not just this, if a symptomatic person is transmitting the infection to others, it tends to be longer, which means that more than 2 cycles, 2.5 cycles, whereas asymptomatic always is shorter. That means maybe it will end after 1 cycle of transmission. And generally, asymptomatic people give another infection only in asymptomatic way. Therefore, the complications are fewer, whereas symptomatics
Babu, could you explain that further? You know, for people like us who aren't medical experts, what do you mean by 2 cycles and 1 cycle? If you could just explain that in more detail.
Yeah. So if I am symptomatic, I would give infection to one more person. That is 1 cycle. And that person is also be symptomatic because he has got it from me who is symptomatic. So that person will again give to another 1 person. That is 2. So when we find the difference between symptomatic and asymptomatic, the number of cycles that the symptomatic spread is longer, which is 2.5. Whereas when you look at the asymptomatic, it's fewer. Maybe I'll give to only 1 more person, and even that person will have no symptoms because he has got from a person who does not have any symptoms. And those who have symptoms are more likely to have more complications, including death. So therefore, this study, what clearly it brings out is, during a controlled setting of lockdown, it was only the symptomatics, and just for the audience knowledge here, Karnataka by far had the best contact tracing during that time, which means that because there was a controlled setting, we could actually find out that the asymptomatics were actually spreading to wider number of people and for longer period of time, which means we are justified in targeting symptomatics as the mainstay of containment.
All right. So what does this study now mean for government policies, for authorities, or, what sort of direction, what do they need to focus on?
Gagi, what's happening is generally when the testing is increasing, this study is not focused only on testing, but the overall containment efforts. So what this study provides, first caution is it's a preprint and it has to be peer reviewed. And once it is peer reviewed, the policymakers will have to consider doing syndromic approach, which means that you find more and more people who have symptoms by an active search in the community from house to house or even in the hospitals. And even if you're missing one or two asymptomatics that will not have major impact in containment efforts, you should not miss even one symptomatic person because they are more likely to have complications. They're also more likely to die compared to asymptomatics. Therefore, syndromic approach is the way forward. This is what this study is clearly bringing out.
And of course, the big mystery about why are some people asymptomatic, why are some people more symptomatic, is it all to do with comorbidities, also, the amount of exposure to the viral load?
I have to caution the group asymptomatic. This is from a line list data. So therefore, some of them might have developed symptoms later on, but this study does not track that. But as you rightly said, why people do not develop symptoms is something for science to find out. There are several mechanisms suggested. First mechanism is that maybe they have better ADE, antibody dependent enhancement, which means there's perfect immune response for antigen and the antibody. Therefore, their body is well equipped to fight with the virus. And it is more likely that the young people might have such a better response compared to the elderly or those with comorbidities. The role of T cell immunity and the others is yet to be established.
All right, so that is something which continues to be studied, and of course it's just been 9 months of living with this disease and the various researches and studies. Dr. Babu, do stay on with us for our next big focus on the show today, and that is the issue of restrictions and lockdown in controlling the spread of coronavirus. Now today, 2 Indian states have brought back restrictions to deal with rising COVID cases. First is Chhattisgarh, which has taken the drastic step of bringing back a week-long lockdown in 10 districts of the state. This includes the state capital, Raipur. The state capital, which has been reporting 900 to 1,000 daily cases, has in fact been declared a containment zone. So Chhattisgarh bringing back a lockdown there in many of the districts. The Rajasthan government has now imposed prohibitory orders under sections 144 in 11 districts, including state capital Jaipur, from today in view of the rising cases. Section 144, remember, prohibits the gathering of 4 or more people. Chief Minister Ashok Gehlot, who actually announced the decision on his Twitter handle, said that the move has been done in public interest. Well, let's go back to Dr. Girdhar Babu to talk more about this strategy of lockdowns in countering the spread of disease. So what is important for these states to do? Is it because they're also finding that a lot of hospitals are getting filled up, that they need to, increase medical help and improve that? If that's one of the reasons for this lockdown, so they can get a handle on all of this?
Yeah, that's a good question, Gagi. Now, India had by far the most comprehensive and the longest lockdown anywhere in the world. This was the time for us to get prepared in terms of preparing health system to counter any potential surge in cases in the future. If states have done well during that time, they may not require another lockdown just to prepare the health system response. Let's say you're buying ventilators or you're ensuring that there are some equipments or testing kits. All these procurements could have been done even without lockdown. But if there is some little fine tuning that you want to do in health system, you want to bring in a new technology to sort out the case allotment to the hospitals and things like that, maybe 1 week lockdowns might be helpful. But from the disease containment point of view, these 1 week lockdowns or prohibitive orders are not going to be really helpful in the long run, because people need to understand with the unlock, there is free movement everywhere. The only way we go forward is follow 3 W's, which is wear mask, wash hands, and watch your distance. the PCs, which is clusters, close spaces, and close contacts.
Right.
These are the only ways in which we reduce the transmission. Without doing that, if you want further more lockdowns, I think these are all transient mechanisms.
Sure, it may be a transient mechanism, but also the big worry now, Dr. Babu, is how it's spreading to rural areas. So now to have, 11 districts of Chhattisgarh under lockdown and so many districts of Rajasthan under lockdown, this is because also, our rural health systems remain a big concern. And if the disease is spreading there, clearly it's a big challenge for authorities.
Yeah, you're right. This is definitely a major concern as the pandemic spreads out to the tier 2, tier 3 cities and the rural areas. So there are states like Tamil Nadu and Karnataka which have increased the oxygen supply in the government district hospitals. Similarly, all the other states need to ensure that there is critical care available even in the remotest areas. Even when you can step up things like oxygen supply, manpower is a very difficult thing. So in such instances, Karnataka government has again tried something called tele-ICU, which is strengthening the peripheral doctors by the intensivists from the capital city and other metros. So these initiatives will have to be taken in terms of reducing the mortality in the elderly and those who have comorbidities. Without doing this, just doing lockdowns will not be helpful.
All right, just a lockdown will not help, but of course need to increase these health services. Thank you so much, Dr. Babu, for speaking to us.